My name is Sira Boats, and I am a dementia specialist and occupational therapist of over 30 years, and I'm also a daughter of dementia, and I am here to bring you hope on the dementia journey. And today I just want to talk a little bit about diseases and pathologies that may put you at risk for dementia. I get this question a lot. How can I prevent dementia? Can I prevent dementia, and what can I do about it? And I think one of the big things is to understand your medical risk. So there are some factors that we all have in our lives that may be preventable, or it may be non-preventable. So today we're going to quickly look at the disorders that's linked to dementia according to the Mayo Clinic. So the first disorder is Huntington's disease. It's a genetic change in the nerve cells in the brain and spinal cord that wastes away. It causes a decline in our thinking skills, known as our cognitive skills, and symptoms can appear around 30 to 40 years. So this is genetics. There's nothing that you can do to prevent Huntington's disease. Something that you probably can prevent if you do not expose yourself to sports or you're not a soldier are things like traumatic brain injury and CTE, which is chronic traumatic encephalopathy, which are diseases or situations that occurs when you have repetitive blows to the head. So if you choose not to play aggressive sports, then you can avoid this injury. But once you have that injury, then your brain is damaged, and that does set you at risk for developing dementia later. The Creutzfeldt-Jakob disease is a very rare brain disorder, and it occurs randomly in people. We do not understand the risk factors, but once you have Creutzfeldt-Jakob's disease, then that's not something that you can prevent. They do not know if it is passed down from one parent to the other, but they do think it can be caused by exposure to diseased brain or nervous system tissue. For example, if you had tissue transplants, such as a cornea transplants, which that's quite interesting. I found that interesting. If you have the genetic predisposition for Parkinson's disease and you are diagnosed with Parkinson's disease, then you're more likely to develop dementia later on. So these are diseases and pathologies that once you have them, you're at risk for dementia, and you cannot negate that risk. You're at risk. All that we can do is optimize brain health through health style choices from that moment on. Now, there are dementia-like conditions that may be reversed. These are immune and disorders and infections that, like for instance, a very acute UTI may make somebody look like they have a cognitive change, but it's a short-term condition that's resolved with antibiotics. Or somebody with multiple sclerosis or rheumatoid arthritis, if we are not controlling the inflammation and the pain, that can impact brain function. Metabolic and endocrine problems, thyroid problems, low blood sugar, if that goes untreated, these persons may demonstrate cognitive decline that mimic dementia. But if we reverse that situation, then that will clear up. Low levels of certain nutrients. This is when we do a blood panel to find out if our vitamin B1, B6, B12, copper, vitamin E, our thiamine, which is B1, is affected. If you are not drinking enough liquid, so you stay dehydrated, that's a nutrient your brain needs. So these nutrients, in the absence of those nutrients, you may show a cognitive decline. So those are things we can control through our diet and through hydration. Then there's medicine side effects. A lot of times, certain blood pressure medicine in our geriatric population causes side effects of confusion, dizziness, inability to concentrate and focus, and it may be misconceived as dementia. When we change the medications or take a person off of the medications, then they have improved mental clarity. And then there's subdural bleeding. So for any reason, if you start bleeding on the surface of your brain, that can cause you to have a cognitive change. This can also be when you've had a stroke. And you're bleeding in your brain, then of course that's going to impact your ability to think, focus, make decisions. Brain tumors are very rarely the cause of a cognitive dysfunction, but it can be depending on where it's located. And then there are, the last but not the least, normal pressure, hydrocephalus. So it's a build-up of fluid in the brain, and when that pressure stays on your brain cells, then that can result in cognitive problems. I do want to highlight uncontrolled diabetes, so high blood sugar can cause brain damage over time, and then untreated heart conditions such as COPD, CHF, which is chronic obstructive pulmonary disease, or congestive heart failure. When that's untreated and the oxygen to the brain is impaired over a long time, that can lead to dementia as well. So there are many risk factors that we can contribute to dementia, and then some factors we can change, as we mentioned, but some factors we have no control over. So here is a common risk factor that none of us have control over, and that's aging. Dementia is the disease of aging. So once we are over 65 years old, 1 in 3 of the population will develop dementia. And when we're older than 85 years old, 1 out of 2 people in the population will develop dementia. Family history. If you have genetic disorder, like we talk about Huntington's disease or Parkinson's disease or the APOE genes, then that puts you at risk and you cannot change your family history. And then Down syndrome. Down syndrome is a genetic disorder which, as a person with Down syndrome age out, 50% of them are at risk to develop some type of dementia. So I hope that this overview of the different pathologies and disease processes that we can control and cannot control in dementia gives you some clarity of your risk and how to negate your risk. Thank you for watching, and please follow us for more on our website, where you can sign up for our newsletter and also for our dementia support groups, and we'll see you soon.